Good morning. Welcome to Cuddles and Milk and Petaluma. Today is Monday, November, I almost said October, November 16th, and I am on my last episode of a breastfeeding journey. When I started this, it's really funny. I felt like it was going to be forever. Like I could be doing a breastfeeding journey for, a year or two. And now I'm like, it's only been 12 or 11 episodes. But we've covered a lot, right? We started out with when you first are getting close to that birth and the end of pregnancy. And then when you transition through the days in the hospital, the first few weeks, the first few months. And last time we even talked about what it's like to nurse a toddler, right? Something so different, especially in this country. A lot of people think about that 6-month or that 1-year mark, and they don't always think about past that. So you may not have a lot of friends or family who've nursed a toddler. You may not know what it's like or how is it supposed to be or what's quote unquote normal. So I hope that helped kind of open that door for you a little bit to think about what it could be like and what works for you and your family. Because that's the bottom line, is whatever works for you and your family and your child is what works, right? So you do what works. So today in the last episode 11, I'm just going to talk about transitions. So for today, we're going to focus on getting pregnant while breastfeeding, weaning peacefully, and tandem nursing. So let's start with getting pregnant while breastfeeding. So what's different about getting pregnant while breastfeeding versus non-breastfeeding while you're pregnant is that it might ovulate less. It's not uncommon for women to ovulate much less frequently when they're breastfeeding, even if we're past 6 months, even if we're a year or a year and a half out. It's not uncommon for them to have much more spaced periods. So it may take you a little longer to get pregnant. That's something to consider, that it may be a little bit of time for you to get pregnant, right? So that's one thing to consider, is getting pregnant may take a little more time. And then when you are pregnant, if you have a rough first trimester, it can be really hard to breastfeed during it as well. To just feel like you're really exhausted and you're sleep deprived and you're just so bone tired, and you also have to feed somebody. So that can be really challenging, right? That can be very, very challenging. So kind of give yourself some extra grace that first trimester if you are pregnant and breastfeeding. Let everything non-essential go. That means laundry. It means cooking those healthy meals. It means, doing all the activities and the things that you think that your child needs, and all that stuff, because what they really need, especially at that age, is just you. They would be much happier just holding on, snuggling you and nursing and playing with the block on the floor than having some, enrichment-filled activity at a rec center or a library or a museum, right? They just want time with you. So if that means staying in your jammies all day to make it through that first trimester, do it. Okay, do what works. I also want to talk about weaning peacefully. So when people have dates in mind, especially like, 6 months or a year, they tend to be like, okay, congratulations, you made it a year, now no more boobs. That doesn't always work well. Depends upon your child and their age and how you approach it and how they approach it. There are ways of doing it that are more gentle than others. In general, I would say having an abrupt end where you're like, okay, they could nurse yesterday as much as they wanted, but today there's no boob. That's going to be a little bit more traumatic for the child, right? So even if you know that there's a date coming and you're like, okay, at this date I'm done, you still might want to spend a few weeks cutting down and being like, okay, 2 weeks before that date, hey, we don't nurse at nap time anymore. Now we're just going to read an extra story, right? Or you might say, okay, before bed, you might be out, right? You might be out, or even literally hide in the backyard or whatever it takes, and let your partner put the kid to bedtime so that we're not nursing before bed for a week, right? So those gradual transitions, it's really hard when a child goes from everything they want, like you can nurse fine today, to tomorrow, all of a sudden no nursing. So I would gradually decrease, take out some of those, take out the before nap, take out the nighttime or the first thing in the morning or whatever works for you, but start taking them out a few weeks beforehand if you know. Sometimes we don't know, right? Sometimes mom needs to go on a medicine or something happens and the milk supply is just gone. And then we just have to deal with what we have. okay? But if you do know, if you have some planning and some time, I do suggest giving the baby and you a little bit of warning, right? Because you'll be surprised, as much as you are ready to be done, be surprised how much you miss it too. A lot of moms tell me that they were super ready to be done, and then the minute it was done, they realized their child was fine. They were going to go and play and were totally fine. And they were the ones missing all the snuggles and cuddles and holding and all of that. So be prepared for that as well. But nursing tandem is a whole different thing. So let's talk about that briefly. So tandem means you're doing the two together, right? So you are nursing a newborn and a toddler at the same time. So what is that like, right? That sounds crazy. So first off, I want to say, biologically speaking, it's totally normal and natural. Biologically speaking, humans are meant to breastfeed until probably around 4 or 5, right? So we are not meant to breastfeed for 6 months and then be sent off, or even a year, and then start on cow's milk and never have breast milk again. Breast milk is meant for so many developmental things, and also a lot of preventative. A lot of these preventative things take a long time to get into baby's body and to get that preventative effect. And the longer you do it, the better it is. We know that, for example, a woman who breastfeeds a combined 48 months in her life has a much lower breast cancer rate, right? So 48 months is a long time, 4 years, but that could be over multiple children, right? And even nursing as little as 24 months combined has a lower breast cancer rate. But it takes time for that to happen. And then there's things that happen for the child, right? Lower leukemia rates. But again, that takes time. So we want as much healthy, preventative, wonderful benefits in that breast milk as long as possible. So if you get pregnant, especially if you get pregnant sooner than you anticipated, maybe you only have a 6-month-old or a 1-year-old and you weren't totally planning on weaning, don't. Unless you have some medical necessity reason, unless you have history of very early preterm labor, there's no reason you should stop nursing. If in doubt, if your OB says, I think maybe you should stop, find a lactation consultant. It's a great time to have a team approach and to have more than one person in there, because some OBs just don't know the new research and everything that's showing that there's no reason you can't. There's absolutely no reason in most healthy women that you can't breastfeed while pregnant. Most of the time it did happen years and years ago. So I also want to tell you the coolest fact for today. If you are breastfeeding a toddler while you're pregnant, your breast milk stays mature milk, right? As it's been this whole time since the very beginning. Then that new baby is born and the milk changes back to colostrum. And colostrum has a bit of a laxative effect, right? So that's there to help move babies, newborns' intestines through, get their poop out, get that meconium, get everybody pooping. So it's also not uncommon for a toddler to stop nursing for a couple of days and then go back. I've seen that many times. And I've seen toddlers who will nurse with the colostrum too. They also might not, but a lot of times, I will tell you, there's some real benefits of nursing tandem. One thing is you usually do not get sore nipples at all, not even a tiny bit. Nipples are totally used to it, right? Another thing is your milk is going to be in so soon. You'll transition to colostrum for a day or two at most, and then your mature milk will be in. It is such a huge blessing. You don't need to worry about not having enough. You're going to have enough milk, and it's going to be there so quickly. So it's a real benefit of nursing tandem. Also, if your option is weaning the baby really close to when the newborn's coming versus tandem, they're probably going to accept that new baby easier if they're tandem nursing. If they're not, if they feel like they just got kicked off of the breast and now this new baby comes and takes their space, it might be a little harder for that toddler to deal with. So keep all of that in mind. But remember, anytime you're going through all of these transitions, it's a great time to reach out to an IBCLC. Virtual consults are wonderful for that. I can see a client anywhere in the world. All we need is an internet connection and the same language. Okay? So thanks for joining me at Cuddles and Milk and Petaluma today. I hope you enjoyed this last episode of Breastfeeding Journey, episode 11 on transitions. And I hope to see you again. Next week, we're going to have to start something new. All right. Thanks again. Bye.